Hello everyone, this is Atinder Mukherjee again, and you are watching Chanakkapuri Junction. We were halfway through, when we were discussing about joint pain and Ayurveda, even the global impact of Ayurveda these days. So we will discuss once again, and we will see, what best solutions we can give. Now, as all of you know, uh, health is a big concern, especially the after the pandemic. In fact, during pandemic and after the pandemic, things have changed globally. Pandemic has whelmed the entire world. uh, I don't know, I mean, we have endless number of uh, stories or facts uh, worldwide. That is perhaps the time when people have started believing on Ayurveda more and more, and when people understood the impact of Ayurveda in daily life. So now Dr. Vishaka is with us. Uh, Vishaka, can you hear me? Yes, but I cannot hear you. I think you're yes. Can you hear me now?
Yes, I can.
Yeah, yeah, right. So now, welcome to Chanakapuri Junction, Dr. Vishaka. And, we were discussing about joint pain, and not only joint pain, about the Ayurvedic, the status of Ayurvedic these days. So I
Yes.
spoke to people about the impact of Ayurveda these days, and especially after the COVID or during COVID, people understood the impact of Ayurveda. I have also discussed about few incidents what which happened in the globally during pandemic, after the pandemic. Now I would like to know, or rather, there are a few guests of mine. They were asking me that what is the cause of joint pain? If you can discuss a little bit.
Yes. Thank you for having me. And let's start with what are the causes of joint pain. Now, as you know, we have big joints, small joints in our body, and we do look at them differently because we have to first diagnose we need to have the exact and precise diagnosis to go ahead with Ayurvedic treatment. Because we treat rheumatoid arthritis differently, we treat osteoarthritis differently, and there's also another cause which could be rise in the uric acid in the body.
Okay,
So that
okay,
also leads to something called as gouty arthritis. So that's a third kind of arthritis. So we have to
okay,
first understand what is the exact diagnosis of the patient. Otherwise, the treatment may go wrong, it may not work, and so I also heard you say that Ayurvedic treatment does not have side effects. Well, let me tell you that Ayurvedic treatment does not have side effects if you have diagnosed the case correctly and you have done
absolutely. Yes, yes,
if you've done pinpoint
yeah,
treatment. So that is
right.
called as Shuddha Chikitsa. Shuddha Chikitsa is the treatment that does not lead to side effects. Like when you're treating one disease, if your treatment is leading to another disease, which comes as a
Okay,
side effect, then it is not ethical treatment as per Ayurvedic scriptures. So there can be side
Absolutely.
effects. I'll give you a tiny example. If a patient comes to you with heavy swelling in the knee joint, and
Okay.
the patient also complains of heaviness in the body, laziness, no desire to do anything. He just feels like just sitting and sleeping all day. He's not able to move at all. So, in this case, we have to get his C reactive protein checked first. Because if there is swelling in the entire body, if there is systemic swelling also in the body or inflammation, that could be the beginning of rheumatoid arthritis. Now, if we diagnose this patient as osteoarthritis or just start treating him directly with the Ayurvedic methodology like applying oils and giving medicines for osteoarthritis, then there could be side effects. Because
Okay.
when there is swelling, if you don't treat the C-reactive protein first through Ayurvedic medicines and directly start applying oils, that could lead to increase in the pain and swelling and redness. So that is why here
Okay.
it becomes extremely important. Ayurveda gives utmost importance to diagnosing the exact state and stage of the disease. And once you get
Okay.
that right, it's like cracking an equation. When you put all the values correctly, you get the correct answer. So, rheumatoid arthritis, you cannot start off with Ayurvedic therapies immediately. So, if I have to give you an example, how we go about treating rheumatoid arthritis, it usually affects even your smallest joints. You could get swelling even in these, in your fingers. So, there's difficulty in moving. Sometimes they can also go, like this, crooked, and difficulty in straightening them up. This happens mostly in the mornings. So, in the mornings, the stiffness is the highest, and the
Okay.
patient is unable to get out of the bed immediately. Okay.
Okay.
So when you're treating this patient, you have to obtain his history first. His diet is
Hmm.
definitely going to be inflammatory diet. Inflammatory diet
Okay.
is heavy on milk, milk products, fish,
Hmm.
non-vegetarian protein or carbohydrates, excess of carbohydrates in the diet, not following any dietary regulations or timings, not having any discipline with respect to the eating times, and sleeping late in the night, eating late in the night, day
Okay.
sleep, when you have
Hmm.
your lunch and sleep immediately within half an hour, even that is considered as a cause of increase in inflammation in the body. So
You
so many
you just
advanced.
mentioned about milk. How does milk affects?
So milk has been proven, it has been proven to increase the inflammation and autoimmune
Oh.
conditions also, because it has lactose. Now, lactose cannot be processed by your gut if there is debris in your gut. If the body, there are debris, means cells are dying every
Hmm.
single day. Old cells are dying, new cells are, there's regeneration. So if there's
Hmm.
old debris from the food that you previously ate, if it's stuck in your gut, it does not allow the absorption of nutrients, one thing, and whatever is stuck in the gut is leaving toxins into your system. And lactose is something that cannot be absorbed when your gut health is poor,
Okay.
which is glucose and lactose. Sorry, gluten and lactose. These are the two entities. We have to get
Okay.
the patient off this. So first and foremost, when you're treating a patient with arthritis, we have to ask them to get off milk. Now, I know why you asked this question, because osteoarthritis, it has been said that milk is extremely good because it has
Yes. Yes.
calcium.
Yes. Yes.
But
Yes.
I'm
Yes.
talking
Yes.
about the state and stage here. If the patient comes to you in the initial stage, you have to first treat his digestive system. You have to put
Okay.
him on laghu ahara. Laghu means something that's very easy to digest. The food that's
Okay.
easily digestible,
Okay.
which does not make you feel heavy. Some
Hmm.
examples of that would be rice gruel or rice kanji, that
Okay.
we eat in our Indian culture in different ways.
Hmm.
In South,
Hmm.
they have rice kanji. In North, they make rice kanji differently. In the Western belt, like Maharashtra and Goa, in Goa, we have kanji for dinner, rice kanji. So it's just like
Right.
adding 14 parts of water to your rice, cooking it in an open vessel, letting go of the froth that comes on top, because that contains a lot of starch which is heavy to digest. Also,
Hmm.
cooking your food in cooker is also giving you a lot of problems, because
Okay.
you're breaking down all the nutrients at a very high temperature, at a very high pressure, and you're not left with anything in your food except for the starch and carbohydrates. So
Ah,
that food
okay.
becomes heavy by default. So if you're having rice,
Okay.
like it also, you can see that the rice is stickier when you cook it in the
True.
cooker.
Very true. Very true.
That is
Very
what
true.
is causing inflammation and joint problems also. Not just that, I mean, it could be the cause of many other problems. Any kind of inflammation in the body, this is responsible. Okay. And
Okay.
so when rice gruel is one option, then the second thing, the best thing that Ayurveda recommends when you are on a diet is green
Mm-hmm.
moong soup. It's
Mm-hmm.
called mung bean in the West. It is
Mm-hmm.
very getting very popular now. There are endless recipes available on the internet that talk about mung bean soup, mung bean porridge. So green moong that we have been having in so many different ways in our culture. We can have green moong chilas. We can just make green moong pancakes. Just make soup, or just add some spices to it and have it like a chaat, but the Ayurvedic version of it. So
Okay.
green moong
Okay.
is a very
Okay.
good option. Then we also have barley. Barley is also considered extremely healthy. So if you're making barley chapatis, I mean that's an amazing replacement to gluten or other
Okay.
wheat-based chapatis. So this
Okay.
is how we give the diet to the patient first. Within 7 days, the CRP levels come down with this diet,
Okay.
and he
Okay.
complains of the complaints of pain and swelling. Instantly the patient says that my joints are feeling more open now. So when he wakes up in the morning, that morning stiffness reduces by 50% if he has followed the diet properly. Leave aside the medicines, just this dietary
Okay.
change brings
Okay.
him to 50%, relieving stage. And thereafter we of course we start with the Ayurvedic therapies. Now if I have to talk about the Ayurvedic therapies, we have a variety of therapies that we select from. We have to see what is the status of the joints. If there is a lot of degeneration, the synovial fluid, if it has decreased, and there is dryness and cracking in the joint area, so you have to ask the patient to flex and extend the joint. While doing
Okay.
so, you hear a cracking sound. What we generally called it is that cut sound, the cut sound that you hear.
Yeah. Yeah. Yeah.
So
Yeah. Yeah.
that is present in abundance. It means that there is a lot of degeneration happening, and you're not having enough nutrients, calcium, enough good fats in your diet to make up for that. So if your rate of degeneration is higher than the rate of regeneration, you are going to lose out on your health, on your joint health, on your overall ojas or your aura, and that will lead you towards aging more. Which is why we
Okay.
are seeing joint pain cases even in the range of 25 to 35 years now. So we
Yes,
have even
I
young
like to
people.
ask a questions. What I have seen, especially people in US and Europe, the younger generations, the age between 25 and 35 or 40, they get a lot of pain in these two parts.
Yes.
Probably for so, what is the is this the cause for using too much of computer and mobile?
Yeah,
And then what
absolutely.
could be remedy?
Absolutely, absolutely. Because when we are using a mouse, our hands are kind of locked in one position. They are just like
True,
this, and we are just using this index finger, okay, and we are using that for clicking. So when the body is put into a situation where uh, it's made to forcibly use only certain parts and not the rest of the parts, what that leads to is locking of that part of the body. And then suddenly when you
true,
release it, you feel like now suddenly the blood circulation started happening. When you're just using it for one purpose, just clicking, the blood circulation literally stops in this area. And when you're doing
true.
this for 8 long hours in a day, you suddenly start realizing that your hand is becoming non-functional. You're not able to utilize it, not able to lift heavy things with this. So it's extremely important that you take work breaks. Like every 1 hour you have to change your position. You cannot be seated in
Okay,
one position, nor can you sit continuously in one posture. Even if you're sitting erect, you're supposed to get off the chair, do some chair. Even there are chair workouts where you can just sit in the chair and do some workouts like neck exercises, bending
true.
down, bending backwards, because your neck is also drooping all the time. So this head's weight is all going on your neck. When you sit straight,
Yes, very
the
true.
entire
Yeah,
body is aligned. But when you're
true,
sitting like this with drooping shoulders and neck, imagine that your head's weight is all on your neck. So it
true,
has to bear that weight. It leads to cervical spondylitis as well.
true,
So you need to keep changing your positions if you want to keep your joints healthy. You have to make sure that you use them as much as possible. Anything that's not used, even a machine that's not used for a long time, starts making sounds. There will be cracking sounds. It will give up after some time. It will be noisy. You're not lubricating it also enough. So same thing with our joints. You have to lubricate your joints regularly. If you've been having a good lifestyle and you're eating your food well, you know how many carbs to take, you know the protein carbs ratio, you know how much fat to eat in your diet. And if you're just simply applying oil on your joints every single day, you will
hmm,
not have joint problems.
okay,
Now, people don't like to apply oil these days. They refrain
hmm,
from applying oil to even their scalp. They don't like it on their
absolutely.
hair.
Yeah, yeah, very true,
How is
very true.
it's oil is basically the fuel for your joints. It's fuel for
Hmm,
your bones.
hmm,
Now, some people also talk about how will the oil reach your bones. There are pores in your body. They can
true,
absorb the oil and they can send it to the areas where it is needed. So the
true.
best medicine for asthi or bones is oil. And even drinking good fat like ghee, and we have coconut oil, we have sesame oil. Even if you have raw oils in your diet, you start your day with good fats in the morning, like 2 to 3 teaspoons of ghee or 2 to 3 teaspoons of oil. We also have something called as MCT oil these days. You get it online. So just
Hmm.
having that can really make you feel like your joints have rejuvenated and they have new life. So if you follow this for a few days after getting your digestion and metabolism corrected, that's
True,
underlined,
very
inverted
true, very
commas.
true, very true,
You will
very true.
see that your
One
joint health is getting better.
Wonderful. Now, one last question for today. If you can, speak little about knee pain, because once you cross 50, most of the people they suffer on for knee pain. Now, knee replacement is also taking place, but I have seen a lot of places, a lot of people, it's not successful. So, what is the cause of this pain? A lot of people they speak that who are into sports or too much of physical activities they get it. There are people who says that no, it is just the other way around. People are not walking too much or there is no physical activities, they get more pain. So we are in dark, we really do not know. That is one. And what could be the remedy? If you can just speak little about
Yeah.
that also.
Yes. So the treatments, I'll come to the treatments that we usually do. Now, we have been, by God's grace, we've been able to treat a lot of patients and avoid their knee replacements. At
Mhm.
Samatvam, at my clinic, we have been able to do that. And we have been able to achieve that by correcting the diet, improving the nutritional status of the patient. And third thing, there's a very, very effective therapy in Ayurveda, which we call as Janu Basti. So in Janu
Okay.
Basti, what we do is it's specifically for the knees. Janu means knee. So when
Right.
you pull, so around the knee we make a ring with urad atta, urad flour, with that is black
Okay.
gram flour, and
Right.
it's constructed around the knee in such a way that you're able to pull or hold oil inside it.
Okay.
So usually start with 7 days, 7 day sessions where the
Okay.
patient comes to the center every day. We do the therapy for about 45 minutes where there are some medicated oils poured in the ring, and then the temperature is maintained continuously for 45 minutes. So
Okay.
it has to be warm, a little more than lukewarm, not very
Okay.
hot. The patient is able to bear the temperature, and we pull that oil. So there is research, there is limited research, but we do have evidences that oil gets absorbed abundantly when you are pulling the oil in a place rather than just applying oil. So you're not able to
Wonderful.
apply that much oil every day because it is going to take 1 hour. You just keep massaging. It will take 1 hour for you to absorb that much oil. So Janu Basti gives you that benefit just by the patient just has to lie down. He has to understand how the treatment is going on and also take in as much as possible. Has to focus on the treatment when we are doing it. So the pooled oil will get absorbed, and every day a little oil is lost, which means the body is absorbing it. And we have
Okay.
to add fresh
Sure.
oil
Yes.
every single day. So 7 to 14 sessions of this, and we have seen that the patient has been free of knee pain by 60-70%. And
Wonderful.
unfortunately, modern doctors, they, I mean, straight out, they say that you have to go for knee replacement without even trying to treat the patient,
Absolutely. Absolutely. Yeah.
which is unfortunate.
Very
And some of
unfortunate.
these
Absolutely.
patients, by doing Janu Basti, internal enemas, that is Yoga Basti, where we give enemas through the anal route. So the intestine has been considered as the seat of Vata. Vata is the one which is causing most of these joint problems. So if you address it at the root, which is at the intestine, it's like cutting off the root and working on the origin of Vata. From there itself, you will see an improvement in the way your joints feel. They'll feel stronger. They'll also start feeling lighter. They'll feel more lubricated. And a lubricated joint is the most wonderful thing that a person can experience. The ease
Wonderful.
with which he can do flexion and extension in the knees. And then we
Okay.
also have other treatments like snehana with
Mm.
oil. We also have patra potali where we tie the leaves in a bolus, medicated leaves like castor, tamarind leaves. We also use moringa leaves and nirgundi patra. So all of these are fried in oil and then we tie them in a bolus and it's dipped in hot oil and we do a massage with that on the affected areas. Osteoarthritis, we have rice potili, where the medicated rice is cooked in decoctions and milk, and that is used for massaging the areas.
Oh,
Milk has
okay.
calcium as
Wonderful.
well, so there's calcium absorption also through that. So we have all
Wonderful.
these specialized therapies which only an Ayurvedic practitioner is entitled to perform. Uh,
Absolutely. Yes.
so, because he understands the status properly, he understands the diagnosis, and we choose the oils based on the stage of the disease and what we are trying to achieve. So, this is how we usually look at joint pain and the treatment in Ayurveda.
Wonderful, Dr. Vishaka. What we'll do, Vishaka, next day we will discuss about sciatica pain also, and then
Yes,
other thing maybe skin, and there are a lot of things we need to discuss. So we'll
yes.
get back on that. Thank you very much for joining us, and
Thank
have a
you.
nice evening. And let's see what best we can do for the society. Thank you so much.
Yes. Thank you.
Namaskar.
Thank you.
Thank you.
Namaste.